that unhealthy food is cheaper. That's why if you want to eat healthy, you can't.
Renowned for its markets, nightlife and parks, the borough of Camden has now been named as the fast food capital of the UK. Home to over 200,000 residents, new data released suggests the amount of fast food outlets has doubled in the last 7 years, to 417 outlets per 100,000 people.
The default at the moment is the unhealthy options are easier. Unhealthy food is cheaper than healthy food. People work hard, people don't have time, there's a convenience to these things. We need to change working conditions and make it easier for people to make healthy options.
Camden has long been a popular tourist destination, accommodating millions of visitors each year and a large non-resident workforce. So it may not come as a surprise to hear that it's the fast food hotspot of the UK. What's harder to stomach is on the same day that these stats were released, the government also announced that 2 in 3 adults aged 35 and over in England are either obese or overweight. While there is no direct evidence linking fast food outlets to obesity, higher exposure to these outlets increases the likelihood of consuming unhealthy food, especially at a time when the cost of supermarket food is at a record high.
That unhealthy food is cheaper. That's why if you want to eat healthy, you can't, because you're priced out, because it's so expensive. All the fresh ingredients, the price has rocketed.
Around us there's about 4 takeaways, and then having to kind of walk into Camden and go to the supermarket, sometimes it kind of feels like more of an effort than just nipping across the road and getting a pizza.
Well, we're over for a short break in London. We decided to see Camden because of the market I'd never been before, and I did actually comment that I'm so surprised with so many fast food outlets. I couldn't believe it in one place.
Local authorities like Camden Council are responsible for approving food premises and for their residents' health and well-being. Camden refused an interview with City News, but in a statement they said,
"We support our residents to access healthy food and to follow a balanced diet. And there's lots of community food projects and food growing initiatives in Camden to helping with this."
If you look at the investment that's gone into local government over the last 15 years, it's been dramatically reduced. So the capacity of the local authority is much lower. So why would we be surprised, therefore, that their ability to fight these agendas on all fronts is as limited as it is?
As health experts and campaigners stew over how to tackle the growing obesity crisis, a collaborative effort with authorities and the food industry is needed to prioritise the nation's health.